Canada is now outpacing the United States in terms of coronavirus cases per capita. This is a concerning uptick.
Canadians do not like being told by Americans that we suck. Evidence of that coming from this CNN report on how the vaccine rollout in Canada has been horrible. And the replies to it, as I'll get to, just made me laugh out loud. So I'm going to share this video, share the replies, and also give you my thoughts on this entire segment, which is not perfect, but is fairly accurate.
Some bad news for our neighbors north on our world lead. Canada is now outpacing the United States in terms of coronavirus cases per capita. This is a concerning uptick, considering that the Canadian vaccine rollout is not going well at all. By comparison, in the U.S., more than 1 in 3 Americans have gotten at least their first shot. In Canada, fewer than 1 in 5 received their first shot. CNN's Paula Newton now finds out what's causing Canada's vaccine drought.
And that's hard to stomach. It's really hard to stomach.
Doctors frustrated, exhausted, as a growing third wave of COVID cases spreads across Canada, even more serious than the first 2. And vaccines are arriving far too late to stem the surge. One horrifying look inside Canadian ICUs filled to capacity and beyond, and it's clear, doctors say, Canada's vaccine shortage is now their problem.
We went through a period where we were rapidly trying to immunize our healthcare workers, both first and second doses, to all of a sudden, we're not getting the supply that we thought we would. We have nothing. And it went down to, I remember weeks where there was no vaccine. Vaccines change the game of this pandemic.
And Canada is still on the losing end. For a country that had categorically claimed to have secured more doses per capita than any other in the world, doses have not arrived in time. And doctors say the early vaccine drought will cost lives. Prime Minister Justin Trudeau says Canada no longer has any domestic production capacity for vaccines, and unlike the US and the UK, was not able to ramp up domestic manufacturing. So Canadians are at the mercy of imports, not even from their American neighbor, but from Europe.
We continue our discussions with the American administration on getting more doses into Canada.
The Biden administration sent 1.5 million doses of the AstraZeneca vaccine to Canada in recent weeks, but there is no announced plan so far to send more. And from Europe, Canada has received more than 8 million total doses, all of it not enough for a country of nearly 38 million people, forcing most Canadians, including frontline workers, to get only 1 dose, with the second shot postponed as long as 4 months. That's prompted the head of the world-renowned University of Ottawa Heart Institute to plead with the Ontario government to quickly get a second dose to medical staff.
It's not a small problem, Paula. It's not a small problem. People are exhausted. We see staff not coming to work because they may have COVID. Are not so sick. They are not hospitalized, but they have symptoms. They stay home even with a potential 1 dose.
And the weeks ahead will be more gut-wrenching still. Many provinces are now locking down and triaging and transferring patients, activating surge capacity in its healthcare system that is now under threat of COVID-19 like never before. And Jake, look, this is a problem. You have to rewind decades to really get to the heart of this problem, but that doesn't let the Trudeau government off the hook. They've been in power for more than 5 years. They heard the dire predictions. This country for decades had a competitive advantage in making vaccines. The research was right here. But look, Canadians will now pay for that complacency. Trudeau promises that domestic manufacturing will ramp up next year. Jake, you and I both know it's just too late at this point in time. This third wave is punishing. I am speaking to doctors, especially in the hotspot of Toronto. You know, Jake, they are letting people into the sick children's hospital, adults, in order to be able to treat them for COVID. A lot of things to talk about here, including the fact that even though the dire predictions were there, no government acted for decades on the vaccine rollout.
Yeah, it's a real failure by the Trudeau government, and our Canadian cousins deserve a lot better. Paula, thank you so much for that. I appreciate your report.
All right. Now, this caused a freak out online, especially with those Trudeau liberal diehards that just can't take any criticism of Justin Trudeau. Now, yes, you could argue this report here and the commentary afterwards could have focused more on the provinces and the premiers, the conservative premiers that have completely botched the entire vaccine rollout, as well as the inconsistent lockdowns that have led to huge spikes. But it's not just that. It's also the lack of vaccine production. We used to have our own vaccine distributor and producer, and I'm going to get to more on that in a minute here. And that was sold off in the 80s by a conservative government. Liberals, despite being in power for many years after that, never brought it back. So you can't just say, well, it's the conservatives' fault because they sold it off. Trudeau's been in power for 5 years. Liberals have had power before that with Chrétien for years and years, and they never bothered to bring that back. So you can't just put blame here on conservatives. And also, in terms of the provinces and the rollouts, there's also, in BC where they have an NDP government, they're also having issues with the rollout and consistent spreading of the virus. So it's not just about conservatives here. It's really all around. There has been a complete failure in the response to COVID-19. Now, let me get to some of these replies that made me laugh. So this one here says, can you send someone to Canada who knows and likes our country a bit? This is claptrap, and I resent the real culprits that are causing this grief are skating because you're decided not to do a bit of research about how this all works. This report was put together by Paula Newton, who you saw at the end of that video, who is Canadian. So the criticism here doesn't make any sense. And even still, look, I have spent years discussing American politics as a Canadian. Most Americans are perfectly fine with that. Yes, there are some that are like, focus on your own country. But for the most part, people welcome an outsider perspective. Even if Paula Newton wasn't Canadian, I would have no issue with this report. I have no issue with having an outsider perspective. I think it's important, as long as you're, of course, educated on the issues, which Paula Newton is. And this report obviously went into detail on the data and what's going on. Then there should be no issue with the actual report. But this person here clearly bothered, thinking that was not a Canadian report. More here. Cindy tweets out, it started back when the previous PM, Stephen Harper, cut funding for research in all areas of science. Canada could have had a vaccine ready by now if the government had left the funds in place. The damage was already done when Justin Trudeau took over as PM. Again, Trudeau's been in power for 5 years. Yes, of course, you can also put blame on Stephen Harper and the Conservatives, of course. But being in power for 5 years, you can no longer have that excuse as, oh, it was already, damage was already done. He couldn't do anything. He had 5 years before this to reinvest into these areas, and a year to reinvest, or at least a year to, at the beginning of this pandemic, to immediately start and create our own vaccine distributor. But did not do that. So the idea of only putting blame on people that used to be in power 5 years ago really doesn't make any sense. Spud here says the most misleading report I've ever seen on CNN. Come on now. There have been many more misleading reports than this on CNN. The failure in Canada is due to conservative corruption at the provincial level, not the federal government. This horribly inaccurate report needs to be retracted, and Jake Tapper owes Justin Trudeau a public apology. Jake Tapper had nothing to do with this report. This was done by Paula Newton, a Canadian, and there are many conservative premiers that deserve criticism, of course, but there are also premiers who are not conservative that have also screwed this up. So, understanding here, a lot of blame to go around. Last reply before I go to a little piece here on Connet Labs. Suburban Voyeur says, Jake, we don't produce our own vaccines thanks to the former government who privatized our lab. Maybe clean up your own backyard before you come at us, compare death rates. So this person also bothered that, how dare you point out that Canada is doing worse? You should be pointing out the death rate in the U.S. But it's a report about Canada. Okay. Canadians really cannot take criticism from Americans about Canada. And obviously I'm generalizing here. I'm sure some can. I can. But it's just there is this consistent comparison that, unfortunately, because of how dominant U.S. is culturally worldwide, we make this comparison between ourselves and the U.S. And in most cases, we are doing better. Healthcare in general, we have universal healthcare. In general, we do better than Americans do. And you can apply that to a lot of issues. I wouldn't say every issue, but a lot of issues. But when there is a clear difference here and a clear failure on the part of Canadians, some have a very hard time accepting that. And you can see that in many more of the comments. I just pulled out 4, but if you read through the comments on this video, it's pretty funny. Last thing here. So as I've discussed or alluded to several times now, we used to have our own vaccine distributor. Here's a bit on this from The Star from Linda McQuaig. If Conant Labs still existed today, its scientists would almost certainly be involved in the quest to come up with a coronavirus vaccine, working collaboratively with other researchers, just as they played a key role in helping U.S. virologist Jonas Salk develop the polio vaccine in the 1950s. From the early part of the 20th century, Conant Labs created and produced high-quality medical treatments and vaccines for Canadians, including vaccines for smallpox, tetanus, diphtheria, and whooping cough. As Canadian medical historian Christopher Ruddy has documented, Conant had so distinguished itself as a vaccine producer that when the WHO launched a global campaign to eradicate smallpox in the 1960s, it turned to Conant for help, according to Ruddy. So Conant Labs was not only a leader in Canada in this field, but worldwide. And we sold them off. And again, that blame, of course, on conservatives, but also on liberals who have been in power since and never brought it back. So plenty of blame to go around here. Still, we are not focusing our vaccinations, at least in Ontario, on frontline workers, which is insane to me. People that interact with the public the most, that work in settings like warehouse settings where they're interacting with 200 other people, those should be the people you're focusing the vaccines on right now. Taxi drivers, grocery store workers, Amazon warehouse workers. But instead, I guess the best we're doing right now is focusing on certain hotspots. But it seems weird to me to have this arbitrary line dividing. By the way, I'm right beside. I can look across the street. I am right beside a hotspot that is going to receive the vaccine for 18 plus. Yet I can't get it because I'm just across the street. So it doesn't make any sense. Focus on frontline workers, essential workers, the people that are most interacting with the public, the ones that are ending up in the ICUs. That's where the vaccines should be going. And right now, at least Ontario, and I think the majority of provinces right now are not focusing on that.